everybody, it's Dr. Warren here at Kalkstein Chiropractic in Baltimore, Maryland. Welcome. Today I'm going to be talking about extremity pain that is spinal in nature. So what do I mean by that? There's a good study called Expos by Rosedale where they evaluated over 330 patients looking at people that came in with specifically extremity complaints. Extremity being knee, ankle, hip, shoulder, elbow, and wrist. So people coming into this study had a complaint in one of those areas, and their understanding was that they had a wrist problem or an elbow problem or a hip problem or a knee problem or ankle problem. So what did the trial of care consist of for those patients coming in through the study? Only spinal work. So it's called directional preference. It's a form of spinal movement and treatment to the spine, and that's the only type of treatment that they had for this study, right? Who got better? Over 40% of those patients with just extremity pain got better when only treating the spine. So the significance of that is, and we see that play out in here a lot, is if somebody comes in with extremity pain, it's important that we look at the spine and treat the spine conservatively to see if we can have an effect on that joint, right? So if someone came in, say, with hip pain, right, by doing mechanical movement to the lumbar spine, over 70% of those people that came in with hip pain got better. Right? That's a really important number, especially for the hip. So, and then we look at other extremities, and most of the extremities in that study, over 30% of the participants got better just by treating the lumbar spine, the thoracic spine, and the cervical spine using directional preference therapy. So here at the office in Towson, we do directional preferences through a technique called the McKenzie method. And it's really effective, and it's nice because one, I can get results with it as soon as one visit, and then also it empowers people. It allows people to do the exercises at home, and it's something that they can do throughout the day to help with their symptoms, especially when they're very severe. So if you're experiencing hip, knee, ankle, wrist, elbow, and shoulder pain, and it hasn't improved by treating just those areas, it's important that you get with somebody, whether it's a chiropractor or a physical therapist, that can help you treat that area from a spinal directional preference. And you can look up people in your area that treat with the McKenzie method. That's a good start for looking for someone that practices in that manner. So if you have any questions about that study, I'm going to post the link below that explains that study a little bit more. And then if you have any questions about how our office treats extremity pain, please comment below. And thank you so much for watching.